from Davao Doctors College. And for today's return demonstration, I am going to perform the female urinary catheterization. But before we proceed to the procedure, let me explain what is catheterization. So, catheterization allows urine to drain from the bladder for collection. It may also be used to inject liquids used for treatment or diagnosis of bladder conditions. Also, it is the introduction of a catheter through the urethra into the bladder for instilling or removing fluids. So, the purpose of catheterization this is to control urinary incontinence, to relieve urinary retention, to obtain a sterile urine specimen, to measure the residual urine remaining in the bladder after voiding, and to maintain an empty bladder during surgery, to provide access for instilling medication into the bladder, and to monitor early urine production in a seriously ill patient. So, now that I have discussed what is catheterization and the purpose of this, let's proceed to the materials. So, the materials needed for this procedure such as the clean gloves, catheter, urine bag, forceps, cotton ball, betadine, draw sheet, eye sheet, 10cc syringe, gauze pad, lubricant gel, hypoallergenic plaster, and also the alcohol. So, let's start the procedure. So, first, check the doctor's order for catheterization. This is to ensure that you have the right patient and right procedure to be done. And then after checking the doctor's order, you need to perform hand washing before preparing the set. This is to reduce microorganisms that cause diseases and contamination. That I already washed my hands, next is to identify the patient's identity and also introduce yourself. This is to establish good rapport and provide the client opportunity to ask or raise for her concern, and also ask the client how she would like to be called, and also explain the procedure to the patient. This is to gain trust and cooperation from the patient. Start mo, Jo. So, good morning, ma'am. I am Maple K, a student nurse. You can call me Maple. May I know what is your name and birthday po? Okay, ma'am. So, ma'am, what do you want me to call you? Okay, ma'am L. So, ma'am L, this procedure that we are going to do is inserting a Foley catheter. So, I will expose your perineal area. But let's assure that I only expose the part that is needed to be exposed and no other people to be allowed inside unless you request to have your partner or one of your family members. Is that okay, ma'am? Okay. Next, screen the patient or lock the door and cover the windows by closing all the curtains if the room of the patient is private. This is to provide the patient's privacy. So at this part, I already closed the door and the curtains, and after that, position the patient in a dorsal recumbent with the knees flexed. This is to provide privacy and preserve client's dignity and for easy visualization of the meatus. So our patient is already in a dorsal recumbent. So ma'am, can you please flex your knees so that we can do the procedure properly? Okay. Thank you, ma'am. Next is to drape the patient, exposing only the part to be cleansed as minimum of exposure, lessen the embarrassment, and helps to provide warmth and apply direct light or visualization of genital area. And the rationale for this is to provide visualization of the meatus is essential to introduce the catheter. So let's assume that we have already applied the light for visualization. So, ma'am, I will expose your perineal area po, ha? Okay, thank you. Next, open the tray and arrange equipment for convenience and accordingly to avoid contamination of sterile items. and place the equipment in order will increase speed of performance, and using the sterile forceps cleanse the area using a cotton ball with betadine. Remember, note particular areas of inflammation, swelling, excessive discharge, or secretion from the orifice, and presence of odor. Let's assume that I've already opened the tray. So next, after you open the tray, you need to open the set. This is to observing sterile technique and put on the sterile gloves. This is strict, as sepsis must be observed to prevent introduction of microorganisms into the urinary bladder. And afterwards, put the eye sheet. This is to clearly identify work area of sterile field. So, I will open the set. Remember, if you touch the cover of the set at the edge of the cover, this is to avoid a After that, put the jaw sheet under the buttocks of the patient. So, ma'am, I will put the jaw sheet under your buttocks po, ha? Okay po, thank you. Then, put the eye sheet. Then after you put the eye sheet, get cotton ball soap in a cleansing solution. Then clean the genital area of the patient. So ma'am, I will clean your genital area po, ha. Then discard. Next, lubricate the catheter for about 1 1/2 inches, being careful not to plug the eye of the catheter. The rationale for this is to reduce friction and prevent urethral trauma, thus reducing pain upon insertion. So, pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb and 1 finger of the left or right hand between the labia minora. Separate and pull up gently. So this is to provide good visualization of the urinary meatus. So I will put the lubricant gel. So after that, insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow, and if a specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in a position. The rationale for this is urine will flow out of the catheter if the lumen is not occluded. Thus, the purpose will be defeated and maintain sterility. So, ma'am, I will touch your genital area and I will insert the catheter. Is that okay? Okay, ma'am, thank you. 1, 2, 3. Then after that, press the hand in the pubis area while holding the catheter in place. The catheter to prevent pulling and pushing of the catheter to ensure placement in the bladder and facilitates inflation of the balloon without damaging the urethra. So bladder or sphincter contraction could push the catheter. So after that, connect the catheter to the urine bag and be sure the bag is closed and keep the connection sterile so that the urine will not leak from the bag and maintaining sterility. So this is the urine bag. Then it starts. I will connect the urine bag to the catheter. So after that, inflate the balloon 10 to 15 cc of sterile water using a 10 to 20 cc syringe. Make it sure that there will be no leakage of water from the balloon, thus it serves the purpose of anchoring into the bladder. Secure the indwelling catheter by taping into the patient's thigh. Allow some slack of the tubing to accommodate the patient's movement. This is to secure the catheter properly. Slacks prevent tension on the catheter when the patient moves. So, I will get 15 to, this is the 10 cc syringe. Then, remove the needle. Then get some sterile warm water. Then inject to the catheter. Then discard. Then after that, place the patient comfortably by positioning and covering to provide warmth and promote comfort. So ma'am, are you comfortable with your position po? Okay, so ma'am, I will cover ma'am ha. Remember, secure the drainage bag, which is, this is the drainage bag, or the urine bag below the level of the bladder. Check that drainage tubing is not kinky and that movement of side rails does not interfere with catheter or drainage bag. So, I will move it. Remember, this is the urine bag. Then put it there. Then this is the plaster. So ma'am, I will take to your one ha. Just like that. So this is the urine bag, and be sure that next do the aftercare, and after that record the time of procedure, done, amount and color of initial output. This cleaning the environment promotes comfort to the client. Moisture is a good environment for bacterial growth. This is to provide evidence of a care. So I will note the Remove the gloves. This is to deter the spread of microorganisms. Then discard it. Then perform hand hygiene. So now I am done with my return demonstration of female urinary catheterization. Again, I am Mapul K. M. Mukamad from BSN 2 12D of Crew 15. Thank you!